Good morning, everyone. Welcome to our weekly forum. We have Brant, we have all the directors, and we're going to have a great time today updating you on some of the statistics and what's going on with the pandemic. First, I want to thank all of you for your cooperation and your support of what we're doing in whipping this thing. We're a long way from being finished, but we're making progress, and that's all we can ask for at this point. I'd like to remind you, if you haven't turned in your form for the liability with regard to insurance, please do. Okay, we've had some increase since our last appeal. I'd like to ask you to put in your liability form as soon as you can. So thank you for what you're doing, and we're going to have a great morning here, and thank you for tuning in. Let me turn it over to Brant, please.
Thank you, Don. We appreciate the opening remarks, and thank you for joining us. This is our weekly forum. It's Friday, the 21st of August. We're going to start this morning by going directly to the board. We'll take a look at the latest numbers.
All right, this is the daily new coronavirus case. It's a 7-day average. We're taking a look at the trend line. You can see continued improvement. Back in early July, we spiked at about 17,000 daily new cases, and you can see the decline over the course of the last 3-4 weeks. And then yesterday, we continued that downward trend. New cases we look at because that's the leading indicator. The trailing indicator is the hospitalizations and deaths. We also are seeing improvement across the board. We go back to that third week of July, 2 weeks after the peak in the number of new cases. We see that we peaked at about 9,500 hospitalizations, and today in the state of Florida, we're down to about 5,000. So we've seen a reduction of nearly half.
So we continue to see good news. The charts are indicating that there is a steady progress. What's supposed to be going down is going down, and the numbers in Florida and Pinellas County support that as well. Here in the state of Florida, we are in day 75 of phase 2, and we are getting ready to enter the second week of our phase 2 reopening here at Regency Oaks. In Florida, we are at 588,000 cases. That's up, as we mentioned, just a little under 5,000 overnight. And our death rate is at 10,000, up 117 cases. So that has slowed significantly. Here in Pinellas County, we increased our death count by about 100. So that jumped up to 587, and those numbers continue to look good as well. Across the United States, we're at 5.5 million people now, and 174,000 Americans have lost their life. The testing in Pinellas County continues to improve. We're up to 184,000 individuals tested, and our infection rate is running about 10.3%. Hospitalizations continue to look good. That's a really important thing that we track so that we are making sure that the health centers, urgent cares, emergency rooms are not overtaxed. And we've only seen hospitalizations in Pinellas County, a little over 1 million people, and there have only been 1,915 hospitalizations, and in our specific zip code, it's 351 cases. So the numbers are good. We are encouraged by what we are seeing. We are planning to move full speed ahead with the changes next Tuesday, the 25th, and we'll be talking about those changes as we do the department reports this morning. I'm going to turn it over to Leslie and have her share the community numbers.
Good morning, everyone, and happy Friday. So for our quarantines and independent living residents, we do have 14. And remember, that's for residents for a non-COVID hospital stay or a vacation they took or a new resident. In skilled nursing, we do have 7 under quarantine, and in assisted living, 0. For staff members under quarantine, we have 0 in independent living, 1 in assisted living, and 0 in skilled nursing. For current COVID or flu-like symptoms that we are testing for, we have 0 in independent living, and in assisted living is 24, and skilled nursing is 37 residents being tested. 0 staff members in independent living, 0 staff in assisted living, and 0 in skilled nursing that are being tested. For our COVID-19 confirmed cases, we still remain at our 3 residents from the past, as well as our 16 employees. So overall, our count, again, is 3 positive residents, but 262 negative test results. For associates, we have 16 positives, but 652 negatives. We still want to continue to receive those negative test results when we are doing our testing. Thank you.
Okay, thank you, Leslie. Appreciate the update. I had a couple of other things that I wanted to share with our residents this morning. And the first piece of news is we finally did hear back from Health Peak. As you know, 2 weeks ago, they had their annual board of directors meeting, and one of the items on the agenda was the expansion of the town hall and wellness center here at Regency Oaks, and we've been anxiously awaiting word since then. I received a notification on Thursday that Health Peak has approved the go-forward plans with that expansion. So I am really excited to share that news. We've been waiting on that for nearly 3 years, and it's going to include an expansion of the town hall, nearly doubling it in size, adding public restrooms, a support satellite kitchen, and then the wellness center, which will permanently relocate our fitness center and create a permanent area where Zelco and others will be able to conduct routine exercise groups so that we can get it out of the South Grand Lobby and create a permanent home for that. So as we move forward and I get access to the plans and the thoughts with the designers and the development team, I'll be sharing that information, but I did want to pass on that it's been green lighted, it's a go, and we're looking for a construction start this year. The second thing I wanted to share is the board of directors will be joining me on Monday for a day of collegial learning. Leading Age, one of our organizations, state organizations supporting senior housing, is having their annual conference, and the board and I have partnered together to do a day of training. So I'm sure there will be some great information coming out of that agenda that we look forward to turning around and sharing with our entire resident base. This week, Health Peak was on site. They did a virtual audit of the campus. They had provided Darwin and his team with GoPro cameras, and they were able to interview the key leadership and conduct a physical plant evaluation of Regency Oaks, all 3 of our product line and buildings, as part of our budgeting process. The budgeting process is well underway. We are shooting for a September 4th initial presentation of our 2021 budget. We currently are just wrapping up our labor. We have previously finished the revenue and occupancy projections, and we're getting ready to jump into the capital plan. So progress is being made. We're confident that we're going to be able to put together an operations and capital budget by the 4th, which is our presentation date. So we will continue to move forward with that. So that concludes my remarks, and I'm going to turn it over to Rance Macy, our skilled nursing home administrator. Rance?
Good morning, I'm Rance Macy. I'm the healthcare administrator next door at the health center. This week on Sunday, one of our CNAs was not feeling well, so we tested her, and she did in fact test positive for COVID-19. Her last day worked was this past Saturday. So as a result of that, we decided to test all the residents in the health center on both the ALF and the nursing home side, just because she worked on both sides and had exposure there. On Monday, the results came back, all the residents tested negative. However, it is a 14-day incubation period, so we are testing all the residents again today on Friday, and we're hopeful that all the results come back negative again. Finally, I just want to introduce Gerard DeHill. He's the administrator who's replacing me. Gerard.
Hi, good morning. My name is Gerard Dahill. I just started here yesterday at the Health Center of Regency Oaks, and I'm very glad to be here. I'm learning a lot under Rance's leadership here, and I'm looking forward to getting to be more familiar with the property as well as the health center. Hopefully by middle of next week, I'll be ready to go. I'm looking forward to meeting all you guys. Thank you.
Good morning, Ricky Baca, Food and Beverage Director. Just another announcement that we're thrilled to have that next Tuesday we'll be opening the dining rooms to 25%. The north dining room will be open for lunch. The north and south will both be open for dinner. The grab and go is now going to be a dinner to go in the tavern. There's no more lunch. No lunch will be offered in the tavern anymore, and we will continue to have the grab and go breakfast for you. Have a great day.
Good morning, Perry Goodbar, Sales and Marketing. We've had a very busy week this week. We've had a move-in yesterday. Miss Gertrude Zellinger moved in. This upcoming Tuesday, we will have Bob and Wilma Radford joining us. And in this weekend as a guest stay are Emilio and Suzanne Petty. They will be joining us later on in September. So lots of good new residents that are joining us. We've had a lot of activity this week. We had a wonderful dinner last night, entertained 8 new prospects. And also this week we had some great help from residents Pat Geisheimer and Adrienne Terrace. So we really appreciate all of their wonderful help. And again, thanks to everyone for making me feel so welcome, and I'm enjoying meeting everyone as we work through and as I am in and out and about the community. Have a great weekend.
Good morning, Regency Oaks. I just have a few things that I would like to mention. Starting next week, we will include on our Monday memo, as well as Channel 732, the full lineup. I know it gets a little bit confusing when we go back and forth between dining chat as well as housekeeping, so we want to create some clear clarification on that. Again, you can always find that on the whiteboard, your Monday memo, as well as Channel 732 if you get confused on what week we're doing the updates or the department updates. We hope that you're enjoying our Tuesday talk as well as our COVID updates, just to change it up a bit. As well as I've gotten a few questions regarding the meal delivery service through transportation. If you have any specific questions regarding that, you can always reach out to Tuck in Transportation at extension 304, and he'll be more than happy to answer those for you. As well as we hope you're excited for our RO experience next week, Viva La Mexico. All of our directors have come up with creative things to make sure we have a great time next week. So that day is Thursday, August 27th. It will be in between the Breezeway, Alfresco Dining, and Town Hall, and we look forward to seeing you. Happy Friday.
Good morning. I'm Christine, with Director of Innovative Home Services. Just wanted to let everyone know we are going to be having a estate sale sometime next week. We don't have a confirmed date yet, but I will have that posted by the end of today in the lobby areas. Look forward to seeing you. Have a great weekend.
We wanted to inform you today we have a few residents experiencing a rash, but they are currently being treated through their primary care physician as well as dermatologist. I want to inform you, if you're experiencing any type of rash and itching, please let us know, and we'll have the wellness nurse, Diana Toscano, come and visit you in full protective equipment to see if this is something you need to follow up with your primary care physician or dermatologist to seek treatment. Now, whenever we discuss about social distancing for COVID-19, if you are experiencing a rash, you should also social distance and not have any skin-to-skin contact with any residents. If you have any questions, please give us a call. Leslie, Resident Services Director at extension 501, or Diana Toscano, extension 542. Thank you.
Good morning. I'm Sandra Novotka, the Human Resources Director. And as you know, we are in the middle of our employee engagement survey. So we are collecting our staff's feedback in regards to how they feel. Currently, we are at our goal at 75%. So we are still working on getting the last few, but I am positive that we will be successful. We have 2 more weeks of responses, so I feel that number will continue to increase.
Good morning, everyone. My name is Darwin Perez with Plant Operations. I just want to give you a quick update on the painting. Because all the rain, we are running a little bit behind. I think we are about 25% on the south building. We are moving forward on that. Hopefully next week we will do better. And also another thing, we did replace the damaged fence around those pump rooms in the back of the south building. If you want to stop by and look at it, we did vinyl fencing. It's better, it looks nicer, and that was complete also. And I heard some in the north building some complaints about cooling towers. They were making more noise than usually, and usually around this time, September and August, those cooling towers run like all the time because it's the hottest months of the year, and that's probably why they're working fine and everything is running pretty good. So thank you.
The one last thing we wanted to do this morning before we go to questions is take a look at Tropical Depression 13 that is currently forming in the Gulf. Let's go to the whiteboard.
This is still a tropical depression, and it is looks to be headed toward Florida. Right now they are projecting that it is going to come up the west coast of Florida, and you can see that Tampa is on the leading edge of the hurricane. That's not where we ever want to be. The good news is this is not anticipated to be anything more than a Category 1 storm, which is for Regency Oaks a heavy rainfall event. The wind is going to be limited. Sustained winds currently are running at about 39 miles an hour. We will monitor this throughout the weekend. Our staff is standing by. It would not make landfall based on current modeling until sometime early Tuesday morning. We are going to continue to watch this and be prepared. At this point, I'm not asking residents to take any action. If something should change over the weekend, you can look for further notifications from the team.
Brant, thank you. And thanks to all the directors for their update. Most of the residents that I speak with still want to know how much longer we're going to be in this COVID-19 state. We're making progress. We're opening up a lot of our facilities. We're going back to the dining room, but we're still constrained. So the question is, Brant, people highly respect your opinion. What do you see? What do you see in the future for us going through phase 2? And do you have any prognosis on when this thing might end for the county that we're in?
So, Don, that's a great question, and I have a little different perspective in terms of trying to predict when this is going to be over and we can get back to normal. I think, in all honesty, we're probably looking at another year before COVID is no longer rampant and something that we're having to deal with. But having said that, I think what we actually are looking at is a new normal. I support getting back to normal operations, to being able to go out and lead our lives, to go to dinner, to go back to the movies, to participate fully in activities, and to go to our dining room and open up our transportation. But the way we do it will be different than the way we used to do it. And so in terms of getting back to normal, the new normal, I think that is happening pretty rapidly. These numbers continue to improve. We may or may not see a second wave. I don't have much of an indicator on that, but I think the new normal is how we are going to define our lives over the course of the next 12 months. And it's going to be people who are always going to be cautious about where they are and their surroundings, people who are going to get comfortable wearing masks when out in public, people who are going to practice good social distancing, and people who avoid the 3 super factor risk: large crowds, not keeping social distancing or wearing a mask, and attending indoor events with a large capacity. Those are the high risk factors that we try to avoid, and I think that our residents will try to avoid going forward.
Well, my next question is for Tiffany. Tiffany, some of the residents, and we have a lot of new residents, of course, and they really don't know what is the RO experience. What should they look forward to? What should our residents look forward to as we begin to open up and go back and have the full experience of living at Regency Oaks? So could you expand on that, please, Tiffany?
Thank you, Don. As Brent just mentioned, we are looking for our new normal. So we understand how important socialization is with our residents, but we want to do that in the most safest way possible. So the RO experience is just a segueing from our monthly cocktail party, but in a bigger venue, as well as being able to have our full bar, meals that will be individually wrapped, as well as just some entertainment. We really want to make sure we don't take away from our monthly cocktail party and what that looked like and what that gave to residents, but we're just trying to put a spin on it so that you can still see your friend from the north building or being able to just get out of your apartment. We want to make sure that this is still social distance, as safe as possible, but we still want to have a good time at Regency Oaks while social distancing. So if you have any more specific questions, you can always contact myself at my extension or Ginger at 505. Thank you.
I have a question for Ricky, and it concerns the opening of the dining room. People are excited about going back in the dining room, and there's a lot of favorable comments coming. But we have some residents that are still a little bit confused on what their options are and how they will get to the dining room. So Ricky, could you try to clarify that for us, please?
Don, to answer your question, the servers are going to call all the residents, and they're just going to ask you if you're going to be dining in or receiving a delivery or going to the tavern for a grab and go. If you do circle menu items for the dine-in option, it will only help out us in the kitchen as far as getting counts together. Thank you.
Well, thank you all for joining us. A lot of good information. We're a long way from being finished with this pandemic. So I ask for your continued cooperation and support Brent, and support all the directors in what's going on. It's going to be a long road, but we're going to get there. So thank you all, and you all have a great weekend.